Welcome to the Kaur Show. This is episode 32. Thank you all for joining us today. We really appreciate your time for joining us in this space. I'm Ranjit Kaur from the UK, and here with me is my co-host Gorinda Kaur from Melbourne. Vaheguru Ji Ka Khalsa, Vaheguru Ji Ki Fateh. How are you, Benji?
Vaheguru Ji Ka Khalsa, Vaheguru Ji Ki Fateh. I'm good, Penji, and how about you?
Yeah, I'm really good, thank you. It's going well.
That's really great. How about lockdown, and is there any change in the UK?
I'm still in lockdown, so I
Mm-hmm.
only go out if needed to get some food or
Wow.
necessities or go to nannies if we ever get a chance to. But otherwise, it's still locked down. Yes, it'll be really good to have the schools open soon or the
Yeah.
gyms, something
Wow.
open, apart from the shops.
I
But
know these days, even a little bit of freedom is actually something, feel a boon. And it seems
definitely,
very weird when you hear about the full freedom.
I know.
But isn't it strange, like this year, 2020 and even 2021, the beginning, like so many things happening. We had COVID and still going on in some countries, and then the farmers' protest all at the same time, and both are kind of unique in our lifetimes. What do you think,
Definitely.
Benji?
No, it is. It's very unique and it's all happening in one go. And it's how we manage it, how we explain it to the world as well. And it's been a crazy week with the celebrities that have used their
Oh
social
yes,
media platforms to help raise awareness for this protest. So I think it's been amazing.
it
And then
is.
there's No Deep Core, which is, we're also talking about how to,
Hmm.
hashtag release No Deep Core. There's so much going on right now. And we've also joined Clubhouse.
Oh, that's right. That's something new. So social media is expanding, and there are more platforms coming up. There's Twitters, and then there's audio platforms. So much happening, and a lot of discussions on the same topics, and so many people talking about this is the buzzword: farmers' protest and
Yes.
Rihanna.
And Rihanna, yes, and all the other celebrities. It's the
Oh,
list is
indeed,
growing. I
it's
think
growing.
once one started, it's really helped open doors for
Mm.
others. So yes, it's amazing.
Yes,
But today
yes.
on our show, we are talking about PCOS, understanding and controlling this. And it's a very interesting topic because many people have inquired about this topic and have got questions as well aligned. So this is really good that we're going to introduce our guest today. So let's introduce Jasmeen Kaur.
Hi,
Hi, good morning. How are you?
good morning. Good, thank you. How are you guys?
Yeah, we're doing well. Thank you. We're really happy for you to come on the show, especially about this topic. So I'm really glad that you've come on. And if you can tell us about yourself and also about this, what you the topic as well, please.
Sure. So I've been a doctor for about 10 years. I've been a general practitioner or a family physician for about 3. I'm really interested in women's medicine and I've done some studying on the side during my training in women's medicine. And I'm currently studying nutrition. I've got 1 more year left. I practice in the UK. I work part-time and I balance my GP work with my family and it works out okay. I'm homeschooling, so I'm feeling everybody's pain at the moment as well. And since the start of the pandemic, I've been working in the COVID hubs. So I've been really quite busy over the last year.
Yeah, it's a challenging times, and the ways of working as well as managing your home circumstances, they have just changed a lot. So Jasmine, you mentioned that you've been working as a practitioner, doctor, for 10 years now.
Mm.
Talking about polycystic, I think PCOS, I'll say.
Yeah.
So polycystic syndrome. Within the 10 years, it seems the problem has actually grown a lot. Even though there is so much awareness happening, we find that so many women are actually suffering with PCOS. Could you just maybe talk about this?
Yeah, so I think that the problem is growing, but also the awareness about it is growing. So more people know that they have it, more people are aware that it's a problem. I think the main thing that triggers women to come in to see a doctor or to become concerned is a change in their periods, and that's the first thing that they do tend to notice. Or they may realise that they're having problems getting pregnant, and that stems them to come into the doctors and have a chat with us and see what's going on. Um, although awareness is growing, I do feel like, particularly in some cultures, polycystic ovaries is difficult to talk about. And I'm really honoured to be here and to help open doors and talk about it, to make it a little bit less taboo. I think it's a wonderful topic that you guys have chosen to ask me to speak about.
No, I'm really glad that you've come. It was actually a friend of mine that wanted to speak about this. So she asked if I knew any doctors that could come on and talk about this syndrome. So what are these symptoms for someone that doesn't have a clue, or how does this start with the symptoms that they have? Is it just a missed period, or is there a lot more?
So there are a set of symptoms that we look for. So as I said, most commonly it's a change in your bleeding or problems getting pregnant. There's also change in your hair growth and your body shape as well. So you will tend to start losing hair around here and then gaining hair around the upper lip and the chin. And that's one of the things. And you may notice that your skin becomes more greasy, you get more prone to acne. And also, but 80% of women with polycystic ovaries tend to be on the larger side. You can still be quite lean and have polycystic ovaries. It's not a defining feature, but the majority tend to start putting on weight as well. Then there's the general symptoms like just feeling tired, not feeling quite right, not being able to put your finger on why. And women don't tend to come forward with those symptoms. They tend to come forward with my hair's growing, my hair's changing, I'm putting on weight, my periods are changing, or I can't get pregnant. And they're obviously very concerning features for women. They're the main symptoms.
And Jasmeen, is there any particular community or ethnic group who are more prone to this particular syndrome, or is it just across all the communities?
Yeah, so it does affect everyone. Diagnosis can be any time after puberty, we say, and most women find out in their fertile years, so between puberty and the 40s. It is more common in ethnic minorities, in Asian and Black women, but it does happen to everyone. It is not exclusively to any one race. The way that it's caused, if you wanted to know about that, it's a bit of a mix between genetics and lifestyle. So there is a genetic component to polycystic ovaries, but we say that, and that component can be passed down from generation to generation. And it's what we say dominant, so it does always show if it's there. And quite interestingly, a mum can pass it on to their son. It can lie sort of sleeping in the sun, and then the son can pass it down to their daughter. So it can travel through the different sexes, which I thought was quite interesting. Although it is genetic, there is loads that we can do to help it in your lifestyle, and there's loads that we can do to treat. We cannot cure polycystic ovaries. That's really important to understand. But we can manipulate it, we can push it to the side, and we can make it so that we can get a grip of what we want to achieve with regards to polycystic ovaries. If it's you want to have children or you want to change your body shape, there are things that we can do.
How do you diagnose PCOS? How do you find out whether someone's actually got it or not?
So a lot of it is on the history, so having a chat, seeing what's going on, see how people are feeling and what they are presenting with, and that's one of the criteria. And then blood tests are the other. Now, the blood tests will show that there is a change in the hormone levels, and that's the real root cause of polycystic ovaries. Now, it's got its name, polycystic ovaries, so you're thinking actually there are cysts in the ovaries, which there are. But they don't need to be present for diagnosis. The cysts in the ovaries are just a product of the hormone cascade going wrong. They're not actually, they don't affect how the disease progresses, and they're not in everyone, but they are something that's found on ultrasound as a product of the change in the hormones in our body.
And Jasmeen, is there anything like before a girl reached the age of puberty, before that something can be done that by the parents, or just to look after and make sure it does not, the chances are actually minimized?
So if the gene is there, it is there. But lifestyle is really, really important. So I think we'll come on to that a bit later, but with a healthy diet and with exercise, and you can keep most things at bay. And polycystic ovaries is definitely one of the things that you can keep at bay if you introduce a healthy lifestyle at an early age.
So if I was to have PCOS, should I see my doctor and tell them the symptoms I have, or do I go straight to a fertility doctor before trying to conceive or before trying to have a family? How would that work?
So in the UK, if you have PCOS, your first port of call is your GP. There are charities as well with lots of information. I've looked them up and I'll give them to you at the end. But your GP or a nutritionist, if you want to go down that route. A fertility expert will take over if everything that the GP has talked to you about hasn't worked or isn't going forward, and they have more in their toolkit. They have specialist drugs that we don't prescribe to help boost fertility. Essentially, that's the main thing that people see experts about rather than the cosmetic problems.
And how would I on my own reduce or diminish PCOS symptoms? Like, what suggestions would you give? So is it only dietary or is there anything else as well?
Yeah. So there is loads that you can do. So the way that for us to really understand what we can do, I think it's important to understand how the disease is caused. And if you don't mind, I'll just spend 2 minutes talking about that so that you can really understand. I think that once you understand what's going on, you feel a lot more empowered to understand why you're being told to do certain things. So as I said, with polycystic ovaries, you've got the genetic component and the lifestyle component. And that leads to the hormone center in your brain pushing increased hormones down to your ovary area. And that leads to an overproduction. That's one way. So you've got an overproduction of something called luteinizing hormone, which is the hormone that is looked for in the blood on tests. And if there's too much of that, the ovaries don't know what to do with it, and it ends up sitting there in a half-cooked state. And the half-cooked state is androgens, and so they're sort of the male hormones. And so if you don't have polycystic ovaries, your androgens get turned to estrogen. If you've got too much, the system is flooded and it can't get converted into estrogen quick enough. The other thing that is really, really important is insulin and insulin resistance. So everyone's heard of insulin, everyone knows it's to do with diabetes, but insulin is a hormone that can affect all the organs in the body as well. Now, it belongs in the cells, and if it's in the bloodstream, it can cause problems. Now, it's long been thought that insulin resistance is because you have a indulgent diet, you have too much sugar, you push your insulin levels up, and then as you push your insulin levels up, the cells can't cope, and you get higher levels in the body. And then with those higher levels in the body for a longer period of time, your body then becomes numb to that. So you need even more for your body to respond. And so with those high levels that of insulin can also stimulate the androgens, which are the troublesome hormones in polycystic ovaries, to develop. So we've got two key things. We've got the genetic component, which is pushing the ovaries, and then we've got insulin. So what you can really do yourself is to help control your insulin levels. So we don't know if insulin resistance is purely because of your diet or there is a genetic component as well. That is still being investigated. But what we do know is that we can control our insulin levels. And if we control our insulin levels, we control our androgen levels. So when your doctor says to you, you need to eat more healthily, what they're saying is you need to stop the amount of sugar that you're eating, the surge of sugar that you're having, to stop the surge of insulin. So that's things like cutting out refined sugars, so your cakes, your crisps, your simple carbohydrates, things that really break down into sugar quickly and then push into the bloodstream quickly and force the insulin to work hard. You want to eat things that have what we call a lower glycemic index. So your whole grains, your brown rice, your legumes, your dals. Punjabi food's very, very healthy if you cook it at home. So all of those things, they break down slower. So the sugar's pushed into the bloodstream slower and your body can cope more. And the insulin level, instead of being a big P, is just a simple line. And that means that your body can cope more and your androgens are less. That's the main sort of dietary thing that you can do. Exercise is really good for burning insulin as well, and exercise is really, really important. And that's where we ask everybody to start. There are a few key minerals which are really important, which you can get naturally in your diet as well, which if you see a naturopath nutritionist, they may recommend to you. So one of them is chromium. Now that's in fruits, veg, whole grains. And that's why it's so important to eat the rainbow and get your 7 fruit and veg a day, we say, rather than 5. And so that helps to regulate insulin. One of the medications that we use is called metformin. And that's actually been compared in studies to something called N-acetylcysteine, which is naturally occurring in yogurt, in cheese, in sunflower seeds. And that is really good for creating something called glutathione, which is an antioxidant. And that antioxidant is really, really good for improving fertility, reducing your hair, allowing your periods to come back. So there are things that are naturally occurring in food that we concentrate and you may have recommended to you. That's the sort of things that you can do at home. That was your question originally. I think I've gone on a bit, sorry.
No, I think that's okay. I think for the people who might have experienced or ever had PCOS, a lot of words and the hormone names you use, they may not be jargon, but for the people who might not have ever been tested for PCOS or any other blood tests relating to that there might be a little bit of jargon. But even remembering my own journey and still going through, I'll say, with polycystic syndrome, I can definitely relate to all these tests and all these estrogens and all these different hormones. I was gonna ask, like, as you mentioned about insulin as well, are there other like diseases or syndromes which are related to polycystic ovaries, and which usually, like, say, inconsistent, if you have one kind of a disease, the other might come in as well?
Yeah, so because we have increased male hormones in polycystic ovaries, we're more likely to get diseases that a man would get. So diabetes, because of the insulin imbalance, is the first one. And that's more because of the insulin imbalance, and you're more likely to get diabetes and diabetes in pregnancy as well. But then you're also likely to get heart disease and high blood pressure and have problems with your weight.
That's terrible. And I've heard, Jasmeen, that there is a high chance that it's actually with people with polycystic ovaries, it's very hard to lose weight for them as well. Why does it make it hard for them? Like doing the same amount of exercise or putting the same amount of effort as others do, it's still hard.
Yeah, and I do really feel for people like that, and that comes down to the genes, the genetic component of the fact that you may have insulin resistance, and that you do. The reality is you have to work a little bit harder, and it's unfortunate, and it's not really fair. It's easier for you to lose weight, and it's harder for you. It's easier for you to gain weight, and it's harder for you to lose it. And that's where it's really important you have to be committed to the reason why you're doing it. And I think that's why it's important to understand why.
Does the NHS in the UK, do they help people with these type of like PCOS? Do they help them with exercise or giving them free membership for the gym so that they can actually get themselves back in order, because it's so much that much harder?
Yeah, so that depends on your area and what is funded in your area. My area does fund it, and it's called something called a exercise prescription, I think. and you just go and talk to the GP, and then they give you a form, and you have either a subsidised gym rate, or they give it to you for free.
Okay, that's good to know, actually, for those who have inquired that question. And what treatment or medication is there for PCOS? Like, is it medication all your life, or is it a temporary thing until you're fixed, or how does that work?
So it's neither. It's not all your life, and it's not fixed. So polycystic ovaries is there. It's just you can push it back. The treatment that you use will really be dependent on your life stage and what you want at the time. So are you younger and just want to regulate your periods? Are you a little bit older and want to have a baby? Or, have you got the complications that come with polycystic ovaries? Everyone's situation is slightly different. There is one thing that I would say is really, really important that everyone with polycystic ovaries knows, and that's that everyone's periods are different. Some women will go months and months and months without a period. Now, it is really important that you have 3 periods a year. And if you're not having 3 periods a year, you need to speak to your doctor and get some help to shed the lining off your womb. Because you've got increased, the hormone balance leads to increased estrogen, and that increased estrogen makes the lining of the womb nice and plump, and it's waiting for a pregnancy. There's no off switch to that, so it becomes thicker and thicker and thicker. So that has the potential of becoming a cancer. So if you're not bleeding 3 times a year, you must see your doctor. And with regards to everything else, if you want to regulate your periods, then they use the combined oral contraceptive pill. If you want to control your hair growth, there are some creams, there are some tablets, but most of it is all done privately and cosmetically. With regards to if you want to get pregnant, the first thing they're going to ask you to do is change your lifestyle and your diet and exercise and try and lose some weight if you're overweight. And then there are 2 main tablets that are used. Metformin is one of them. So you may have heard of metformin. It's a common diabetic medication. And it helps women because it pushes the insulin away from the bloodstream, like I was saying earlier, into the cells. It's out of harm's way and it's doing its job in the right place. And that means that your androgens are reduced. And by doing that, you allow your period to come back. You allow your weight to go down and fertility comes back. It's even been found to reduce the chance of miscarriage if it's used in the first 12 weeks of pregnancy in the first trimester. So if it's used with lifestyle, it's a drug that has a lot of really good results. And then there's another one called clomiphene citrate. Now, clomiphene's used just for a week. After the first 3 days of your cycle. So day 1 is your first day of your period. So they say day 3 for about 5 days. And that pushes ovulation later on in the month.
Yeah, I'm very familiar with all these treatments you've mentioned, Jasmeen. But again, from this platform to our audience, I'll suggest that please see your doctor if you have any concerns and you see any symptoms of PCOS. The advice and the information that we are giving from our show is just for the purpose of knowledge, and so that if anyone has that kind of symptoms, they can visit a doctor and get that diagnosed. With regard to PCOS, again, I know you mentioned that there is increased awareness happening, and because of a lot of words we hear, and there's increased knowledge that's coming up from Google and everywhere nowadays. Do you still think, besides our environment and genetics, is there any other things with the modern technology and with our seating arrangements? I mean, more of the jobs are actually sitting, and we're not, of course, doing more of physical work, as well as we've also heard that the type of milk you actually have also makes some difference as well. Is that true?
So I've not heard anything about milk specifically. Some people, dairy can be really inflammatory, so it can and by that I mean it can cause all the wrong things to happen in your body, and that's to do with you and your makeup. I don't think that would be specific to everybody. Some people, dairy does cause inflammation, and in this case, increase.
Looks like some connection issues at Jasmine's end. We might try to get Jasmine reconnected.
There she is.
Jasmine, can you hear us? Okay. Looks there are some connection issues, and her screen is frozen from my side, what I can see here.
I can't hear you guys.
Can you hear me, Jasmine? No, okay. Maybe if you can disconnect and reconnect back, I think that might help. So just for our audience, today we are discussing about understanding and controlling polycystic syndrome, and we are speaking to Dr. Jasmeen who's a London-based practitioner and has been practicing from last 10 years. And we were talking about PCOS. Maybe Penjiranjit Kaur, you can just brief about what we have discussed so far, and I'll try to connect Jasmine.
Yeah, I haven't. I've had friends that talk about PCOS and how the difficulty is with getting pregnant and weight gain, a lot of weight gain, not just normal weight gain, but a massive weight gain, and also hair growth around the face. So I think that's it's very difficult for them, but they do talk about it, and it's really nice that they openly talk about it. So I get an education like that, but like with treatment and medication, I have no idea, or whether natural medicine would work. So this is why it's really good to ask Jasmeen all these questions, because even like mental health these day and age, so it'd be good to ask all these other questions that I have. And I'm waiting to, oh, she's back. There she is. Hi, can you hear us?
Yes,
Okay.
I can now.
Okay, good. I'll mute and you continue talking. Do you remember what you were talking about?
No, what was the question? Do you want to answer a fresh question?
Garinda was...
No, we were just talking about the sedentary lifestyle that has increased a lot, and also with the food that we eat, there's so much, pasteurized milk, and some people say being vegetarian can help. So probably if you could comment on that.
So being vegetarian has actually been found to improve your health in so many ways. So you have, outside of PCOS, you have increased longevity, decreased risk of heart disease, diabetes, cancer, and that's all because the food that we eat is more, if you are vegetarian, is more dense in nutrients, and it has less of an inflammatory effect on your body. So being vegetarian would help polycystic ovaries because it would reduce inflammation. It's not the only way. If you choose to eat meat, if you want to eat lean meat, if you do choose to eat meat, then and you'll have polycystic ovaries, it's really important that you choose healthy lean meats with low fat. And because they're less inflammatory and they help to reverse the problems that I've discussed already that you said.
Great. Binder Dillon asked a question: can homeopathy treat PCOS?
So homeopathy is not something that I know very much about. I would be inclined to say yes, but you need to speak to a homeopathy expert for that. And I don't have any ideas in my toolkit, I'm afraid.
Yes, they say like Ayurvedic lifestyle, and yeah, and that should work magic for this type of thing as well. Yeah, Govinda Benji.
I was going to say that I've heard that some people say there is a special type of Ayurvedic treatments as well that can help, and even I don't remember that specific type of massage where they do some pins and I don't know what's that called. Acupuncture, yes. They said that really helps. How? I mean, I'm not sure about that. I haven't gone through that.
So what I would say with everything that's sort of on the periphery, so the naturopathic nutrition, the acupuncture, the Ayurvedic medicine, and homeopathy, these things work on the basis that the in the early stages of the disease, and I do completely support them. I think that if you catch something early, then you can use these remedies to try and prevent it progressing, and you can keep it in regression and you can keep it at bay like that. So if you're presenting early and you notice that there's a problem and you see a specialist who is certified, then I 100% support, all of these different aspects, because our health really is not just created from one source. We've got our lifestyle, we've got our genetics, we've got our personal choices, and everyone's slightly different, and different approaches will help everyone. And with something like polycystic ovaries, where although all you're trying to do is reduce the insulin, there are lots and lots of different ways to do it. And I do think that if it's right for you, then it will work. The only thing I would say with that is if you are later on in the disease, things are quite bad. I personally would say to use a medical approach first and then work your way back to the natural approaches. It just depends on where you are on the scale at the time you seek help.
Yeah, that's very important. And Jasmeen, at what stage or how can parents actually start the conversation with teenagers if they feel concerned that that can be an issue with their girl child as well? How can they start conversation about this?
So when hormones are raging, it's difficult to have any conversation with a female teenager. The most important thing to remember is that you can't make the diagnosis before puberty has ended. Your bloods will show irregularities every month because your hormones change every month. And it's not fair to take a snapshot of your hormones on 1 month and say, yeah, okay, this is definitely a problem, when the next 3 months it may be completely normal. Your periods take years to settle as well. So they can take a good couple of years before they bed in and they settle. I would say if there is a big discrepancy, so if you are having you have one period and you have a few periods and then you don't have periods for like 3 or 4 months, then I would say it's important to speak to the doctor. If you're missing one period here and there as a teenager, I wouldn't worry too much. You don't want to overdiagnose. You don't want to give somebody a label when they don't have it as well. And that's really, really important. Obviously, the talk about lifestyle and diet and exercise, that's invaluable to anyone at any time. It doesn't have to be related to PCOS at all.
That's very right. We've got some comments along with Liana. She's mentioning this is really interesting. What sort of food can I eat to help with PCOS? I think we have touched a bit. Maybe if you want to mention any more on that, Jasmeen.
Yeah, so 5 to 7 fruits and vegetables a day, Liana. Lots and lots of whole foods. No processed foods. Well, little processed foods. So your sweets and your crisps. Less so. And the most important thing is to cook at home. So cooking with your family is really, really important. And you find that actually you're eating quite healthily when you cook at home anyway.
Yes, the more the natural, the better, I suppose. And that's in this day and age quite difficult to do when you're the rat race, you're running around. And in COVID as well, it's very difficult. But the more you can do natural is better. I wanted to ask you, how do women feel mentally during the medication? So mental health is a massive factor right now. Well, it has always been. But how do they feel? How do they feel? Is it like something they've taken the pill or they've got the insulin and now they can see a drastic change straight away? Or is it after so many weeks? How does that work?
Okay. So any medication we take, it's always a balance between how you're going to feel with it, the side effects, how you're going to feel mentally with it. With metformin, it takes a couple of months to work. And then you do start to lose weight, and because the insulin's being put into the right place, and you are losing weight, you do tend to feel a bit better. But that does come with a caveat that at the start you can get some tummy upset, you can get a little bit of diarrhea, little bit of bloating, and that does tend to pass, particularly if you use a lower dose and you start slowly. And so metformin does have really good results because you physically feel better, and your hair can change and your periods come back. So all of that pushes you to lift your mood in a sense as well. Clomiphene, which is the really specifically used for fertility, isn't so nice. It can cause you to have hot flushes, and it can cause you to have sweats and sleep problems as well. But you're only taking it for a few days to try and push you to ovulate. The combined pill, which is used to regulate your periods if you're not trying to get pregnant, most women are absolutely fine on, and most women do get a bit of a boost in their mood as well because they feel better because their hormones are more regulated.
Absolutely. Another question from Binta. She's asking if any multivitamins can help as well.
Thank you. Yeah, so vitamin D is really important, as is vitamin C. What I would say with multivitamins is know your brand, have a look, read the box, and you want it to have vitamin D, all the B vitamins, and vitamin C in it specifically. I don't endorse any brands, but specifically those ones are important.
Is there like a random question? Is there like a day of the year where people talk about this as awareness day, like PCOS?
I think there is, but I am not sure of the actual day that it is. I think there is an awareness, PCOS Awareness Week, and there are two charities. I've looked them up. One is in the UK, which is done by QMUL, which is the university that I went to, and that's called Verity. And then I looked up one in America and Australia as well called PCOS Awareness Association. So you don't need the week if you want to get some help. There's those two websites which I had a look at and I thought were really good, and I'd highlight to you guys.
No, definitely. I think it's amazing that there's so much you can learn from this topic alone. And, periods, especially in our Asian community, we don't really talk about periods much. And I remember when I was young and I missed a period, it's because I didn't eat well that week. It had nothing to do with anything else. But you go to the doctor and they're like, are you eating well? And it's like, yeah, I kind of forgot this time. And as you grow older, you end up eating too much,
That's so true. And see, we have all these awareness week. That does mean, do you think there is really a risk factor that has increased so much that we need all these awareness months?
Our lifestyle is just very much now fast. So eat fast, work fast, and we don't take time out for the important things. So our health does suffer. So because we don't take time out to prepare our meals and we don't take time out to exercise, and I am very much a victim of it too. I talk about exercise and I talk about healthy eating, but it's really difficult to fit in at the moment. And I think that all of our health after this pandemic is going to suffer a little bit. We just need to move as much as we can.
I've also come across women who haven't, increased their weight. They are still slim, haven't put on much weight, but they're still diagnosed with, polycystic ovaries. What you can do in that case?
Yeah. So 20% of women who have polycystic ovaries are on the leaner side. And just because they don't have the physical appearance of the increased fat tissue, they still are getting that peak in insulin. And that peak in insulin is too much. And that may be caused by genetics rather than diet. So the treatment is still the same. It's just working internally, just because it's not having a physical presentation of the disease. It's still the process that's going on there, same process.
And how much weight do you think one should lose? Do you know?
So that's really dependent on each person.
So is there a percentage of what their weight, BMI, something like that?
Yeah, so in the UK we work out the BMI, and we would say that we want you to aim for your BMI to be less than 25, and that we found that does specifically, I know, it does specifically reduce the risks associated with fertility and disease progression in polycystic ovaries.
I laugh because I can never get to 26 or 25. It just takes me forever to get there with like loads of exercise and loads of vigorous. But yeah.
The thing I would say with BMI is be careful, because if you are exercising a lot, you put on muscle and that muscle is heavier. So don't always go on it.
Yeah, I do body pump, and that is a lot of muscle, and it's major cardio. But yeah, I was just thinking, like, with like what Gorinda Benji was saying about teaching and raising this kind of awareness with children. Like, with children, we talk about even COVID, this disease. We also talk about cancer, and we also talk about other topics as well, like racism and other things, and disability. At what age do you get them awareness for PCOS? Like, what is that, just for girls, or it should be for boys as well? And it should be from an age where they learn at school, or when they're older, or just leave it so they don't have that awareness? Or is there like a certain age that they should know?
So I think knowledge is power. I think that it's important to sit down and talk to a girl about PCOS if they are stressed about their periods and if they have problems with their periods. For sure that it's something that we should be highlighting and making more people aware about. Covering it in school and things like biology, so that everybody hears about it and it's not so much of a taboo, would be amazing. I think that, it is something that is important to bring forward. I find that talking about things as they come up with my kids is quite good. So, just widening the topic a bit. So personally, if my daughter recently brought up periods, and I said, hold that thought, don't speak to anyone else, speak to me, and we'll talk about it later. And we did. We spoke about it later. And I think that now that she knows, she understands. She's not going to say anything to anyone else that could be offensive. I think that's the most important thing, having the chats at home, and being really open with things at home, so that people understand how other people may feel and the wrong things don't come out. Is just as important as understanding yourself as well.
I don't think I ever learned about PCOS at school or college, or it was just through friends actually that had the issues. I remember when I was growing up, we used to have random women come to the house, and my grandma used to be able to, like, she was like a dai, like, one of those like an unqualified nurse, but would help babies move around in the womb so you could get them to have labor in the right way. So she used to tell me about her experience, and otherwise I would never know that existed. Other issues that, medical issues that if my mum had, she'd like warn me, if one day you can't have children, it's because I had this experience and there are other ways. So I was really like, so if it never happened for me, I wasn't actually afraid, because I had that knowledge from a young age that, adoption could be fine, fostering could be fine. So these things were already in my mind. But I think if it was a shock to me at an older age, I'd be like, oh, wow, I wish I had known. So I was thinking that, it would be good to teach the children, not my 4-year-old, but like a 7-8-year-old, by the way, we just did this topic on the Kaur Show, and this is what it means for girls, and that type of thing. Yeah. Knowledge is power, definitely.
Yeah.
I had another question, and it's regarding the hair growth on your facial hairs, especially. So some people say once you actually treat PCOS, and if it gets treated successfully, do you think the hair that had already grown, they will go away as well of its own, or not?
So some studies have shown that yes, that the hair does go away, because the hair is being pushed by the androgens, which are the hormones that are causing the problem. So by stopping the hormones being a problem, you're stopping its manifestation with the hairs. And that's why metformin and N-acetylcysteine have been shown to reduce hair, because they reduce the androgens. There's one other tablet called spironolactone, which is used by the specialists. So yes, if polycystic ovaries is controlled, either with your diet or with the treatment, then the hair does become less. It's not a magic cure. It's not going to go away completely, but it can become more controllable. The mainstay of treatment for hair, though, is cosmetic. So it's laser and hair removal. That's the mainstay of treatment.
Which isn't guaranteed either.
No.
So, yeah. And I remember when, again, my grandma used to say, you know, when you're pregnant, you might get really thick hair on your legs and you might get a beard that comes through. But don't worry, it goes off as soon as you finish your pregnancy. And she was right. I did have really thick hair on my legs just during pregnancy. And then all these like little tiny hairs would come up, like, where's this come from? And it was only during pregnancy. But when the pregnancy ended, they'd go. And I'd be like, oh, wow, okay. So I think it does happen when your, you know, levels are going higher, you know, things happen and it's very temporary. But I think with PCOS, it is very different and it will take a lot more time maybe.
Yeah.
I just have one more, just cautious of the time. We know that IVF treatments treatment for fertility that have actually, it's become very common these days. We hear it everywhere, so many advertisements. Was it always like, you know, the PCOS and infertility issues relating that much, like inconsistence? Like, or is that the fertility issue has actually grown a lot relating to PCOS? How would you relate that?
Yeah. So fertility is a massive area that lots of people are having problems with at the moment. With regards to PCOS, we try everything that I've talked about first. And if that doesn't work, then you are recommended to have IVF, essentially. I think the reason why IVF is such an utilised tool at the moment is because one, because of PCOS. Two, because women are having children later. They're focusing on their careers. And if they're having children a bit, which is absolutely fine, you know, it happens. I'm one of them too. If you focus on your kids, if you focus on your career and you have your kids a bit later, or you get married a bit later, then your fertility is already that little bit lower. And that's just a fact of nature. And if your fertility is a bit lower, then more people are utilising IVF, essentially. And that's why there is such a push for IVF at the moment. There's also lots of talk about the fact that our lifestyles change so much that our fertility is going down. But that's neither here nor there, really. I think it's very dependent on your personal circumstance.
Is it possible that somebody would have PCOS and a thyroid issue as well at the same time, or is it just diagnosed with one? Because otherwise you'd be taking medication for two things for like balancing.
Yes, it's very possible that you can have a problem with your thyroid and polycystic ovaries. The hormone centers are independent of each other, but they are linked. It's not like the diseases are linked, but if you have one condition with your hormones, there's a chance that you'll have a condition with another. And yeah, you could be on your thyroxine for your thyroid and your metformin for your ovaries at the same time.
Wow, that's terrible. If you had like all these other, you know, it's all interlinked. But yeah, it makes one question. If you've got one issue, maybe then go get checked out for the other, because the symptoms they seem quite similar with regards to fatigue and tiredness, and gaining weight with thyroid is an issue as well. It's you know, it's very difficult.
I think it's a very horrible journey, really speaking, from experience as well. Like, you have to deal with so much where there are physical issues. It's a taboo issue as well. Like, you don't know who to talk with, whether friends, family, where to start with. So that causes a lot of mental, you know, health issues. It can lead to depression as well, because you don't know what's happening and what you are doing wrong. And then, you know, all these leading to infertility later on if it's not treated on time. So, and especially the facial hair issues, which is growing a lot in South Asian females. So there are definitely. So I think the earlier it's treated, and, you know, lifestyle management, it's very important, and we need to keep on raising the awareness about this. I think yes. So it was really, really, really very informative. Jasmeen, would you like to share any last comments over this topic?
Thank you for having me on. I've really enjoyed being here. I hope that I've helped some women and
Definitely
understand a little bit more about what's going on. And come and see your GP if you're worried about anything. Okay.
No, definitely. We've just got 2 comments that I'll read out. Liana has said, this was so helpful. Thanks. Would be great to hear from Dr. Jasmeen another time about other areas of health and how nutrition can help us. Nutrition is a massive, subject in itself, because a lot of people want to know daily what they should eat or what options there should be, and they want a whole meal plan, because options are always good to have. Kamkor has said a very good subject to discuss. This
I
is
was just
definitely a
gonna
taboo
ask,
topic, and when you do have these issues, where do you go? Yeah, Benji.
I was just gonna ask, is there any special type of dietitian for this particular problem that you can see?
So your GP can refer you across to a NHS dietitian, and all NHS dietitians are good at dealing with insulin and helping you to combat it. And there are loads in the private sector as well. But a dietitian and a nutritionist, really important to see if you want to go down that route and if it's right for you at the time of your illness and where you are in your illness.
Great. So Jasmeen, if people wanted to contact you and find out more or ask you a certain question privately, how can they get in contact with you?
So you can get in contact with me via Instagram. That's the best way to get in contact with me. I can't give personalised medical advice because I don't know your medical history, but I can give general advice. And yeah, just look me up on there. Dr. Jazz.
And your handle is Dr.
Jazz.nutrition.
Dr. Jazz at Nutrition, yes. So we would like to thank Jasmeen today for sharing her wonderful journey to us all and giving us so much knowledge, because, even I've learned loads about PCOS today. So thank you so much for that. And if you would like any more information, please follow her on her social media for further questions. Govinda, have you got any last comments?
No, I think lifestyle, that's what we need to work on. And thank you so much, Jasmeen.
That's okay.
Yes.
Thank you.
Thank you so much. And thank you all. And we will hope to see you again next week with another topic. If you've got any comments or a specific topic that you would like covered, then please send us an email to hello@thekaurshow.com. And if you want to see any of our previous shows, then please visit our website, thekaurshow.com. Thank you, everybody.